My name is Dr. Shelly Harkins, and I am the President and CMO of St. Peter's Health in Helena, Montana. Went to medical school in North Carolina, where I'm from, and joined the Air Force while I was in residency. 9/11 occurred. Just really felt a strong desire to serve my country. So I did a civilian residency and then went straight into the military, and I was very fortunate to be accepted at Scott Air Force Base. It was really a launching pad for me to see myself as a true leader, someone who could go, move, and shake and change the world. There comes a time in every military professional's career to make this a lifelong 20-year commitment or to move into the civilian sector, and I decided to move into the civilian sector, and the reason for that is because I had become very interested in hospital medicine, particularly in being a hospitalist. I was at a point in my life where I felt I had arrived. This is all I ever want to do. I'm a doctor one week, and I put on my administrative hat the next week, and we're making progress, and we're doing great work, and I'm having fun. This is perfect. How lucky am I? Back when I first started my career in the military, one of my mentors there said, if you can ever work, practice your craft, do your thing in a place you would vacation, you need to take that opportunity because it does not come around very often, if at all. Sure enough, St. Peter's Health had an opening, and I just went for it. And from the moment I got off the plane here in Helena, things just started lining up. And so we're 6 years in here at St. Peter's in Helena, and boy, the things we have done are just miraculous. This is where I needed to be through COVID. I really thrive in that kind of environment where the whole team is together and we are all equals and everybody around the table has something important to offer. We were so fortunate and happy that we had established this affiliation with the University of Utah before COVID happened. That isolation that gives us that hometown comfortable feel can also be a little risky through things like COVID. Without the University of Utah through COVID, I know that we would not have been as successful in giving our community that sense of assuredness that they're covered. We've got them. We know what's going on. We've got the right information. If you get sick, come to St. Peter's. We know what to do. We will take care of you. When it comes to being a CMO, I've always pushed the boundaries of whatever that job description might say. I just see a vision for what we should be, and no matter what it is, it's mine to figure out and solve. And the number one thing we have to do is take care of our people so they feel valued, they feel heard, they feel part of the solution. So they wake up and go to work and say, this is the best place to work. Our number one value is that we will treat all people with dignity, respect, and loving kindness. We use the word love fearlessly, unapologetically, and I think the world needs more of that.